Now here you can see the isolated presentation of the ventricular system of brain. Now what are the components of ventricular system of brain? We have removed the cerebrum and cerebellum posteriorly, so only the ventricles you can see now. So you can see this C-shaped structure, almost C-shaped structure. This is the lateral ventricle, number one, lateral ventricle. So this is the anterior horn as it is in the projecting in the frontal lobe. So this is anterior horn. This is a similar, bilaterally similar structure. So this is right lateral ventricle, this is left lateral ventricle looking towards you. So you are looking it from the frontal lobe aspect, and you can see this, there is a connection from left and you can see there is a connection from right. Both are merging to the midline structure, singular structure, this number 5, which is known as third ventricle. So this is lateral ventricle, this is third ventricle component. So this is third ventricle, and in between the third ventricle, inside the third ventricle, you can see a hole, aperture. Why this aperture is here? Because grazing the third ventricle lateral wall, here will be the left thalamus, and grazing the lateral wall of the right side of third ventricle, here will be the right thalamus. So both thalamus will be connected by a nerve bundle connection through this hole, hole number 6, which is known as interthalamic adhesion. Okay, clear? So this third ventricle having 4 recesses, that means extra bulged out portion known as recesses. So which are they? Number 1 is this, number 8, inside the optic chiasma, this is supraoptic recess. Inside the infundibulum of pituitary, it will be infundibular recess. So optic recess and supraoptic recess and infundibular recess. Clear? Then I rotate it, go to left side, and this connection line, thin slender connection, which you can see going downward, this number 12 is known as aqueduct of Sylvius, through which the CSF will be coming down to the fourth ventricle. This rhomboid shaped fourth ventricle, posteriorly it is jutting out little bit, and you can see it posteriorly jutting out. So this is number 13. There will be, this is the totality of the fourth ventricle, and this there laterally there will be 2 holes, one towards left side and another will be here towards right side. So what are these holes named? They are lateral apertures, and foramen of Laschka and foramen of Magendie, they are named. And this number 15 is continuation of below the continuation of fourth ventricle. There will be another aperture. This is known as median aperture, through which the CSF will go into the subarachnoid space. Now the components and parts of the lateral ventricle. So you can see the lateral ventricle, it is a triangular in shape in cut section, in coronal section. If we make a coronal section here, the cavity of the lateral ventricle is triangular. So this is the roof. This is the medial wall of, and this is the lateral wall or floor. So this floor is carved medially. The roof is carved anteroposteriorly. Above the roof there will be a white fiber bundle which is known as corpus callosum, C-shaped, and in between the anterior horn, these two anterior, there will be septum pellucidum, thin membrane bound cavity filled with CSF like fluid. So corpus callosum will be on the roof of both the lateral ventricles, and in floor here will be different structure. From medially there will be thalamus, and laterally will be different structure, we will discuss later on. And so it is a triangular in section filled with CSF. This is the body of the lateral ventricle, this is the frontal horn of the lateral ventricle, this is the occipital horn or posterior horn going to the occipital lobe, you can see bilaterally towards, slightly curving towards the medial side. And from the junction of occipital and lateral horn, a body of the lateral ventricle, one limb is going downwards inside the temporal lobe of the brain, that is known as inferior horn or temporal horn. So temporal horn is also having an outer surface, one inferior surface. This is the inferior, from below you can see the inferior surface of the both temporal horn and the both lateral ventricle, you can very well see, and this is the occipital horn. And choroid plexus will be in the roof of the third ventricle, and in the lying in the floor of the lateral ventricles you will find the choroid plexus, which will secrete CSF. So this is a brief introduction.